Hi, thanks for asking me to give a little chunk of info about things I consider as a vet when I'm managing a dog with arthritis. For me, some of you might have seen some of the stuff I've done with Cam before. As a behaviourist and a vet, one of the elements that I really consider is how sleep plays a role in arthritis management. Because we know that if you're not getting enough quality sleep, it impacts on your perception of pain. And dogs don't seem to be any different to that than a lot of the research that's been done on humans. So obviously if you're in pain, maybe you don't sleep as well. But recent research has shown that actually if you are not sleeping well, you perceive your pain much worse. And so making sure that we address the arthritic dog having quality sleep patterns is really important. Simple things we can do, we can just make sure they've got comfortable bed that's easy for them to get on and off, low to the ground, perhaps something like a memory foam mattress. Needs to be a firm to medium pressure surface, but individual dogs are a little bit different. We just want to make sure there's no loose bedding that they can get their legs caught up in, that it's big enough for them to lie flat out on and make some choices about their space. Dogs like to sleep in social contact, so having that bed near perhaps where you're working in the day or where you spend time in the day, and then maybe having that bed near you at night. And if the dog is really quite arthritic and unable to get up the stairs, then maybe look into things, methods of carrying them up the stairs or teaching them to walk up the stairs really slowly, carefully, if that's appropriate, using a supporting harness maybe. If they're not, then then maybe just having some of your scent nearby, some of the t-shirt that you've worn, some socks that you've worn, that's going to be near their bed overnight when you're not in close proximity. Just a few things to think about when we manage those arthritic patients.